Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So there was a question which was asked on the types of research. All right, we spoke about the types of studies before. Now we're going to be dealing with types of research. So the research is actually based on, it can be described in various ways, right? Based on purpose. Why are we doing the research? That's number one. Based on methodology. What is the method of technique of your research? What exactly are you doing in your research? Then time frame, whether you're going to a longitudinal or you've just taken a snapshot, which is cross-sectional studies. Nature of data and the control and manipulation in the research, right? And where is it being done? So there are many parameters in which you can describe the type of research that you're doing. Is it a basic research? That means, my thesis was on the microscopic and macroscopic features of placenta in normal and high-risk pregnancies. And this was not adding to anything, actually. I was thinking, what is that? Is it doing? Is it applied or it's not? This was not applied. This was basic, fundamental knowledge. So that means high-risk pregnancies do have certain features microscopically. And you can be benefited by it because maybe it will help you add the medical legal parameters, or it might aid in some further research. But just that study alone was basically fundamental research. That was one. Applied research, that means it's solving a practical real world problem. Like, for example, a new drug to treat PCOS will be an applied research. Then action research, that means something which is already, the practice was done, already there, but it's to improvise those practices, like improving the hand hygiene practices in the hospital. So you were doing hand scrub till here, and now it's saying that if you do it till here, till the elbows, it's further more beneficial. So this is action research. Then evaluation research. That means the program which is already running, the policies, intervention, you are asserting its effectiveness. That means something which is already going on, is it still effective in the current scenario, or it needs to be improvised further? So you're evaluating on already going on evaluation research, right? Maternal health program is going on, now you're just seeing how successful is it. Okay, you started a program, now you know how successful it is. So this is based on the purpose. Then based on the methodology. Methodology, that means whether it is quantitative research, you're having a numerical data or not. When it's qualitative research, that means there is no numerical data. It's based on your feelings or experiences or perceptions. And then there's a mixed research. It's got both, right? Then you have based on time frame, like I just told you, whether it's a snapshot, cross-sectional studies, or a longitudinal research, that means prospective or retrospective, both. Based on the nature of data. So it's primary research, that means I just started this research, or it is like a meta-analysis, your research, and now I'm combining all of them to understand. So this is a secondary research. I've not done the research. I'm just finding out the literature, the data. Then control and manipulation, whether it is just a descriptive research, you're not interfering. Whether it is analytical or observational research, again, you're not interfering. You're just examining the association. Whether it is experimental, here you're intervening. You're giving some drug, or you're stopping a particular phenomenon from happening. That. And then it's quasi-experimental. That means it is similar to experimental, but not completely. And it lacks mostly randomization. So it's kind of a biased research. Then you have, based on the study setting, where are we doing this research? Is it field setting? That means we're out in the environment. Or is it a clinical research? That means it's done in the hospital setting. Or it is an epidemiological research. That means maybe I'm talking about disease, its patterns, its distributions, follow-up, or it's being done in the laboratory. So it's a laboratory research. Are you with me, guys, so far? Any further questions? This is a summary table, so you can do it in one. So that means purpose, methodology, time frame, data nature, control level, and setting. Where is being done? These are the fundamental factors which describe what the question was. Types of research. And here I described to you the different types of research. All right, guys, are you with me so far? We're done with a very important question, types of research. If you've got any questions, make sure everyone is there in the chat room, and make sure everybody corresponds with me through any questions that you feel that you need to be clear about. And I think in the last class, somebody asked me about a strobe analysis. I've included that also in the class tonight. That I think it was a question asked in fact exam, and I made sure that you get an access to what strobe analysis is. There's a possibility that can be asked during exams. All right, Dipali, you will be added very soon, shortly. There are many students who are currently waiting to be added if you're there in the class. You'll be added immediately after the class, all right? If you're there, Dipali. Yeah. So you'll be added immediately. There are many students who joined towards the last time when I was just about to start the class, and I didn't have time to check on certain things. So you'll be added with them. Don't worry. Everybody who's paid will be added. No problem in that, right? Okay. And okay, so you have some questions. Okay, so as far as the recent advances in revision is concerned, recent advances is a completely different package which is given free of cost to all the students who take my theory classes. That is theory package, updated theory package. And recent advances is also free of cost given to all my students who take mega course package. Now, these two are the only two course packages in which my recent advances given free, and all my live classes which I'm taking on the theory course are given free of cost. Live classes on practicals, which I've also taken before, especially interactions with my students, have been added to the practical folder. The classes that I have taken on the answer bank have been added to the answer bank folder. All right. Now I'm talking about just the, what else now do you want? The access to stats part 1 is a theory class, which has been added to the live class recording folder of the theory package. That means updated theory package, right? If you want to just take my live class recording folder, that is also separately available. I'll make sure that somebody calls you from my backend team. Make sure that you drop in a message in WhatsApp so that I know what class do you want to access. All right. Yes, as far as my recent advance is concerned, again, recent advance is also a folder which is given free of cost in my theory package and in my mega course package. But if you want to take only recent advances, that is also available as a separate package, guys, right? So you can access that at any point in time till your exams, and you'll be helped by my backend team. Don't worry, as far as purchase goes, as far as any technical issues goes, my team is always available. So make sure that you just let me know through WhatsApp what your problem is, and I'll make sure that I solve your query the moment I lay hands on my phone. Now, coming to a good research question. Now, here I would want everybody to just close their eyes. Think about how would you answer this question in the exam. Suppose if this is thrown at you. A good research question or a good research methodology, how will you form? See, when you think, and all of you have been through it, right? When you have to write down a paper, when you have to present a paper, when you have to write down thesis, right? All of you think about a research question. What things, what qualities come in your mind when you're thinking about a good research question? The first thing is that how many cases will I get? How will I prove my point? So very important is the relevance of that theory question. If that theory question or that hypothesis question or that research question is not adding any value to anybody's life in any which way, why do you want to take that kind of research question? So what is it trying to prove? Number one, the relevance of the theory question. Then the feasibility of managing that theory question, whether you'll be able to get some cases or not, and what is the burden of those cases. For example, you take cases, how many cases of shoulder dystocia leads to brachial plexus injury? You're looking at a very tiny figure. Okay, and there's a very huge possibility that you miss most of those cases because they usually happen in emergency and you're busy somewhere else. So to take those cases, to tap on those cases will be very difficult for you to, so you've taken a little unreachable, not very feasible, a little irrelevant kind of a topic. I won't say irrelevant, but yes, it's a difficult topic. So your research question becomes suddenly very difficult to handle. So the feasibility, the relevance, then the importance, okay, and then the population size. So here I have a few characteristics of a good research question. First of all, it should be a very focused research question. It should target a very specific issue. You should be very clear in your mind what are you trying to prove by your research question. Otherwise, if you are ambiguous, the whole study will be ambiguous and you'll not be able to handle till the end what you were trying to prove. Not only that, your methodology, your statistics, your explanation to your statistician, what you want to achieve, what exactly are you looking forward to, your methodology of the discussion of results, everything will be in vain. So you need to have a very focused, a very specific, targeted, research question. Number one. Number two, it should be clear. It should be easily understood and unambiguous, right? Third, it should be very feasible. It should be can be answered with available resources and in the right amount of frame of mind. So it should be very feasible. It should be can be answered with available resources. Then it should be researchable. That means can be answered using empirical data. It should be researchable. Then ethical. You should not flout with any ethical principles. This I did not tell you, right? So deliberately you are withholding a drug of cancer for the patients with cancer. You can't do that. It's unethical. So you will not get the permission from the ethical committee for such a research. Very important point, right? Then the relevance, like I told you, what is the relevance? What am I trying to prove? So all these are the characteristics of a good research question. Very clear, very focused, feasible, researchable, very important, researchable. And my answer I can find using the kind of data that is available, right? So for example, if you take a research on, let's say, preeclampsia or GDM, you'll get umpteen patients, right? You will be able to prove or disprove your point. And I'll be going in a minute on hypothesis. What do you mean by hypothesis? And I have a beautiful way to explain you what hypothesis is. And you'll be crystal clear in your mind what do you mean by research question once I discuss with you the hypothesis and the null hypothesis and the alternate hypothesis. Giving a quickly as a thumbs up from my students, or a thumbs down if you do already understand what you mean by null hypothesis. How many of you really understand what do you mean by null hypothesis? Quickly give me a thumbs up or a thumbs down. I always interact with my students like that, and this time I fortunately have time. So I need to know from all of you, how many of you understand what null hypothesis means? Just no questions asked. Give me a thumbs up or a thumbs down. I need to know what my class is, already capable of having. So Anita is there, Meghna, Sheelu, Kajal, Vijay, Lakshmi, Sara, Sonal, Umesh. Give me an answer. What do you know or you don't know? Great. I love this. I love this when you are honest with me, so that now I know how much to pause, what to tell you, how long to keep explaining you, so that I know that you've been able to draw home the message that I wanted to tell you, right? Yes, Umesh, Kosyeha, Swagatika. Very good, Anita. You've been honest. Kamyani, I need your answer. Ruchika, I need your answer. Very good, good. Sonal is there. Kajal, I need to know. Dipali is there. Dipali is always very active. So Dipto is there. Shwelati, come on, let me know. Right. All right. Okay. So I'll explain you everything. And after that, you will have no issues regarding understanding what you mean by null hypothesis. What exactly is a good research question? All right. Now let's go to find out what. So we've already told you what good research question is, right? And a few examples I've just elaborated on it so that you're able to understand what I'm trying to tell you. So